Welcome back to Long COVID Doctor, an educational series for those of you who are still suffering from long COVID. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now working in Long Covid Services for 5 years. I post on podcast channels and YouTube. I hope you find them helpful. If you do, click subscribe. Let's spread the word. So, thanks for any feedback. Apologies for the no replies. I just haven't got time. I'm terribly sorry about that. I read them though. I appreciate them and they help me with future postings. Another apology, my usual disclaimer. It's important though. Any advice or treatment that I mention, please should only be considered after talking to your own doctor. So, this talk is all about breathlessness in long COVID. I've divided it up into two parts to make it less tiring. So in part one, I'll talk about the symptoms and what you're actually experiencing, and then lead on from that to the causes. In part two, I'll cover the treatments and strategies of how to deal with breathlessness in long COVID. So here we go, breathlessness in long COVID. What are our patients experiencing? What are our patients telling us in the clinics that I work in? So basically, breathlessness is shortness of breath, being out of puff. Need to basically stop and catch your breath. The need to stop and when you're walking upstairs, for example, or even just walking out on the flat, stopping to catch your breath. Breathlessness could result in a sort of a rapid, shallow breathing, a gaspiness or wheeziness, or a rattling in the chest itself. There may even be sort of a dry cough. The chest may feel tight. It may feel heavy. It may feel sort of encased. There may be a feeling of suffocation, which obviously is a worrying sensation. Our patients are saying that they actually sort of actively have to take a deep breath in. It's an effort. It's an effort to actually expand the lungs. They have to actually focus on breathing, which is unusual. Normally it happens without even thinking about, obviously. So what should you do if you've got breathlessness with your long COVID? Well, obviously, anything new, you're going to have to visit your own doctor. You need your family doctor, your GP, to look into it because it's something new. We mustn't be COVID blind. We've got to look at the symptoms and basically explain the symptoms, get a diagnosis. Even being COVID blind is all about, even with your new symptom, in this case breathlessness, we can't necessarily put it down to the fact that you've had COVID. It might be something completely unrelated that needs treatment. So let's not be COVID blind. Diagnosis first. And to get the diagnosis, it's off to your doctor. Doctor will want to know all about the symptoms. So the history, as we say in the medical world. Get the history, the symptoms, and the features of your symptom, the features of your breathlessness. What brings it on? What relieves it? What makes it worse? What makes it better? Any other associated symptoms, say with the throat or the voice, or maybe it's some indigestion associated with it. Thinking sort of reflux of acid coming up into the back of the throat and the larynx, bringing about breathlessness and that dry, irritating cough. The GP will then want to examine you, of course, and that's only right. Of course that's right. And the GP will get his or her stethoscope out and listen to the lung fields, listen to all the different areas around the chest to make sure that the entry of air into the lungs is full and normal. So the breath sounds basically alter according to what's going on in the chest. The GP will be looking for and listening out for wheeziness. And then it's on to blood tests. the standard blood tests for long COVID, looking at the sort of what we call the full blood picture, the liver function test, the kidney function test, sort of looking for anemia, looking for thyroid, looking for all those other conditions that we want to exclude. The GP may be suspicious about a blood clot on the lung, so the GP may request something called a D-dimer blood test. Investigations, well, it's all to do with the breathing, isn't it? So logically, you're going to want to have a chest x-ray to look at the lung fields. Peak flow test, looking for asthma, and that can lead on to something called spirometry, looking at the elasticity of the lung and airways, looking for any reversibility of tightness of the airways, otherwise known as asthma, or COPD, chronic obstructive pulmonary disease. The GP hopefully will want to do oxygen saturations with a pulse oximeter, that little sort of gadget that is put on the tip of your finger to measure the percentage oxygenation within the bloodstream. That may also lead on to something called a 1-minute sit-to-stand test to see whether the oxygen levels are maintained when you're over 1 minute sitting, standing on a repeated basis. The 1-minute sit-to-stand test. The GP will be looking out for what we call in the trade as red flags. So red flags are sort of those symptoms or signs that are suspicious and point towards more sinister underlying conditions. So weight loss, of course, unexplained weight loss. Is that cancer? Chest pain. Is it chest pain due to heart strain, for example, or angina or heart disease? Is the chest pain suggestive of a blood clot? I mentioned that earlier. A blood clot on the lung, a pulmonary embolism. That's definitely a red flag. Unexplained cough that's been persistent for more than 3 weeks. Is that a lung cancer? Or blood, of course, if you're spitting out blood, obviously, again, is that a lung cancer? So any of those other symptoms, a GP is going to want to take, will obviously register and consider as a red flag and refer that patient accordingly. So remember, with this whole process, it's all to do with safety first. Get a diagnosis, rule out other causes, and then proceed. So, proceed in the sense of proceed with breathlessness due to long COVID. So, what are the causes? That leads us on to asking, well, what brings about breathlessness in long COVID? Why are long COVID patients getting breathless? Why have they, following on from the acute initial infection with COVID, why are they breathless still? Well, there unfortunately are a number of causes for them to feel breathless. So basically, it might be due to inflammation of the airways, from the upper airways down to the lungs themselves. So that might be due to something called mast cell activation. Have a look on my MCAS or mast cell activation podcast YouTube to learn more about that. The problem may be lower down than the airways. It may be actually in the air sacs in the lungs themselves. There may be secretions, inflammatory fluid, exudate we call it, in the air sacs themselves. Those secretions would then obstruct passage of air from the what we call the lumen of the sac in across the wall and into the bloodstream. The wall of the alveoli may be damaged or inflamed, so again, that's an obstruction to normal passage of oxygen across that air sac alveolar wall. Then there may be problems with the blood vessels that surround the alveoli, so what we call the capillary bed. So when oxygen has gone across the capillary wall of the across the alveolar wall into, it should then go across the capillary wall, blood vessel wall, and then into the blood, oxygenate the blood, and taken around the body. So if the capillary bed, those little minor blood vessels that surround the alveoli, the AF sacs, are damaged in any way, then that's going to be an obstruction to passage of oxygen into the bloodstream. So what can happen? Well, inflammation, of course. Long COVID is all to do with inflammation, isn't it? That can cause problems with the capillary bed, but also microthrombi, those little minor blood clots, minuscule blood clots that can be anywhere in the body. There may be quite a few of them around inside the lung, in the lungs, or in the capillary bed, the blood vessels. So that's going to cause breathlessness because you're not getting enough oxygen into the circulation. And then further afield, the amount of oxygen and carbon dioxide in the blood is controlled by specialized receptors in what we call the carotid body, which is a sort of an area in the carotid artery where the common carotid in the neck, this is where the carotid bifurcates, go to the internal and external carotid. There's a collection of cells there which sense the degree, what we call the partial pressure of oxygen and carbon dioxide. Those cells then send signals to the brainstem. So if there's damage of that carotid body, then that's going to cause a sort of incorrect oxygenation, and then that will cause breathlessness. And then leading on from that, I've already given you a hint, upstairs in the brainstem, the respiratory center, if that's been damaged in any way, and then the control of the breathing is not going to be efficient and consequently lead to breathlessness. And that can happen with dysautonomia, dysfunction of the autonomic nervous system, of which there are lots of causes for that. Again, listen to or watch my dysautonomia recent update on that. And then finally, we're getting there. Final cause of breathlessness in long COVID is that the breathing pattern, your normal breathing pattern, can be abnormal. So this is a condition called breathing pattern disorder. Instead of your breathing being sort of slow and deep, your breathing pattern has become a bit more rapid and shallow, a bit more sort of hyperventilation-like. So this is called a breathing pattern disorder. And we can assess this by something called a breathing pattern assessment tool called the BPAT. And this gives you a sort of score on your breathing efficiency, if you like. If you're scoring 4 or more, then you have breathing pattern disorder. Right. So, why have I spent what seems to be a long time talking about the causes of long COVID breathing problems? Well, I've done that intentionally because it does help you, the patient, for your sort of validation. The causes are real. There are causes there. Yes, it's real. It's research, evidence-based. It's not imagined. No, it's not all in your head. It helps you with your acceptance because your understanding brings peace of mind. Therefore, as a consequence, it's less of a worry. There are less niggles going on in your mind. What's happening? Why am I breathing like this? And it also helps you rationalize the logic behind how you're going to manage that breathlessness. And also it gives you an idea of some expected outcomes. So that's why I've sort of gone on and about the causes and sort of trying to really explain it in detail in as simple language as possible, the causes of long COVID breathlessness. So that brings me to, because there's been a lot of information there, that brings me to the end of my talk. It's part one of this talk of breathlessness in long COVID, and what you're experiencing and their causes. In part two, I'll talk about how we're going to tackle them, the treatments, the strategies. So, see you there. All right, see you then. Bye.